Question 1. The performance metrics show a statistically significant increase in patient-acquired infections within the medical imaging department over the past quarter. Considering the principles of standard precautions and the need for a proactive approach to infection control, which of the following actions best addresses this trend? Option A. Increase the frequency of terminal cleaning for all imaging equipment to be performed after every patient examination. Option B. Continue with existing standard precaution protocols, assuming the increase is due to external factors unrelated to departmental practices. Option C. Implement a mandatory policy requiring all patients to wear isolation gowns and masks upon arrival for any imaging procedure. Option D. Conduct a thorough risk assessment of all standard precaution protocols currently in place within the medical imaging department to identify potential gaps and areas for improvement. The correct answer is D. Conduct a thorough risk assessment of all standard precaution protocols currently in place within the medical imaging department to identify potential gaps and areas for improvement. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical radiation technologist, MRT, to balance the immediate need for diagnostic imaging with the fundamental obligation to protect both the patient and themselves from potential transmission of infectious agents. The performance metrics indicating an increase in patient-acquired infections highlight a systemic issue that demands proactive intervention, not just reactive measures. The MRT must critically assess the current standard precautions in place and identify areas for improvement, considering the specific context of the medical imaging department. This involves understanding the modes of transmission of common pathogens in a healthcare setting and implementing appropriate controls. Correct approach analysis. The correct approach involves a comprehensive risk assessment of the existing standard precautions within the medical imaging department. This aligns directly with the principles of infection prevention and control mandated by regulatory bodies overseeing healthcare professionals. Specifically, it requires the MRT to systematically evaluate all aspects of patient care, from patient arrival and preparation to equipment cleaning and staff practices, to identify potential breaches in infection control. This proactive, evidence-based approach ensures that interventions are targeted and effective in reducing the risk of healthcare-associated infections. It reflects best professional practice by prioritizing patient safety and adhering to the ethical duty of non-maleficence, while also safeguarding the health of the MRT and other staff. Regulatory frameworks for MRTs emphasize the importance of maintaining a safe environment and adhering to infection control protocols, which are underpinned by risk assessment principles. Incorrect approaches analysis. Focusing solely on increasing the frequency of terminal cleaning of imaging equipment without a broader assessment is an incomplete approach. While equipment cleaning is crucial, it does not address potential breaches in hand hygiene, personal protective equipment, PPE use, or patient screening for infectious risks upon arrival. This narrow focus fails to identify and mitigate all potential transmission routes. Implementing a blanket policy of universal patient isolation for all imaging procedures, regardless of suspected or confirmed infection status, is inefficient and impractical. It can lead to unnecessary resource allocation, patient discomfort, and potential delays in care, without a clear risk-benefit justification based on a proper assessment. This approach does not demonstrate professional judgment in tailoring infection control measures to specific risks. Ignoring the performance metrics and continuing with existing protocols assumes that current practices are adequate, which is directly contradicted by the data. This passive approach represents a failure to uphold the professional responsibility to continuously improve patient care and safety, and it could be seen as a breach of the duty of care and a disregard for evidence-based practice, potentially violating guidelines on quality improvement and patient safety. Professional reasoning. Professionals should approach this situation by initiating a systematic review of their department's infection control practices. This involves 1. Understanding the specific pathogens of concern and their modes of transmission within the medical imaging environment. 2. Reviewing existing policies and procedures for standard precautions, including hand hygiene, PPE use, environmental cleaning, and waste management. 3. Observing current practices to identify any deviations from established protocols. 4. Consulting with infection control specialists to ensure alignment with current best practices and regulatory requirements. 5. developing and implementing targeted interventions based on the identified risks, with a plan for ongoing monitoring and evaluation. This structured decision-making process ensures that interventions are evidence-based, proportionate to the identified risks, and contribute to a safer healthcare environment for all. Question 2. The monitoring system demonstrates a patient presenting with symptoms indicative of a potential thyroid abnormality. Considering the anatomical location and typical vascular supply of the thyroid gland, which imaging approach would best facilitate accurate diagnostic assessment? Option A. Imaging of the entire thoracic cavity to assess for systemic involvement of the endocrine system. Option B. Imaging primarily of the cervical spine to rule out referred pain as a cause of the patient's symptoms. Option C. Imaging focused on the anterior neck, ensuring visualization of the thyroid lobes and isthmus, with consideration for the superior and inferior thyroid arteries' typical branching patterns. Option D. Imaging of the parathyroid glands located posterior to the thyroid, without specific attention to the thyroid itself. Correct answer is C. Imaging focused on the anterior neck, ensuring visualization of the thyroid lobes and isthmus, with consideration for the superior and inferior thyroid arteries' typical branching patterns. Explanation. The monitoring system demonstrates a scenario where a medical radiation technologist, MRT, is tasked with imaging a patient presenting with symptoms suggestive of a thyroid disorder. This situation is professionally challenging due to the critical nature of endocrine system imaging, requiring precise anatomical knowledge to accurately identify and assess the thyroid gland and its surrounding structures. Misinterpretation or inadequate imaging can lead to misdiagnosis, delayed treatment, or unnecessary interventions, directly impacting patient outcomes. The MRT must exercise careful judgment in selecting appropriate imaging protocols and positioning to optimize visualization of the thyroid, considering potential anatomical variations and pathological changes. The correct approach represents best professional practice by prioritizing accurate anatomical identification and optimal imaging of the thyroid gland. This aligns with the Medical Radiation Technologists Board's mandate to ensure safe and effective diagnostic imaging. By focusing on the specific anatomical landmarks and relationships of the thyroid gland, including its location in the anterior neck, its vascular supply from the superior and inferior thyroid arteries, and its proximity to the trachea and esophagus, the MRT can ensure that the imaging procedure captures the necessary diagnostic information. This meticulous attention to anatomical detail is fundamental to providing high-quality diagnostic images, which is a core ethical and professional responsibility of an MRT. An incorrect approach that fails to adequately consider the specific anatomical location and relationships of the thyroid gland is professionally unacceptable. For instance, if an MRT were to perform imaging without a clear understanding of the thyroid's position relative to the trachea, they might inadvertently exclude crucial portions of the gland or include excessive surrounding tissue, compromising diagnostic accuracy. This could be considered a failure to adhere to professional standards of practice as outlined by the Medical Radiation Technologists Board, which implicitly requires competence in anatomical imaging. Furthermore, if the imaging protocol does not account for the typical vascularization of the thyroid, it could lead to suboptimal contrast enhancement or an inability to assess potential vascular abnormalities, again, falling short of best practice. Such oversights could be construed as a breach of the duty of care owed to the patient, potentially leading to adverse events. The professional decision-making process for similar situations should involve a systematic approach. First, the MRT must thoroughly review the patient's clinical information to understand the suspected pathology and its implications for imaging. Second, they should access and apply their comprehensive knowledge of endocrine system anatomy, specifically focusing on the thyroid gland's location, size, shape, and relationships to adjacent structures. Third, they must select and adapt imaging protocols to ensure optimal visualization of the target anatomy, considering factors such as patient positioning, radiation dose optimization, and the use of contrast agents if indicated. Finally, a critical review of the acquired images for anatomical accuracy and diagnostic adequacy is essential before concluding the examination. This structured approach ensures that all relevant anatomical and technical considerations are addressed, leading to the highest quality diagnostic outcome for the patient. Question 3. System analysis indicates a medical radiation technologist has completed a chest radiograph on a patient experiencing significant kyphosis. Upon initial review, the image demonstrates adequate lung fields and visible ribs, but there is noticeable anterior-posterior displacement of the scapulae, and the clavicles appear to be projected superiorly, obscuring the apices of the lungs to some degree. The technologist is considering accepting the image to avoid repositioning the patient, who is in considerable discomfort. Which of the following actions best reflects adherence to the Medical Radiation Technologists Board standards for radiographic quality and patient care? Option A. Proceed with a repeat radiograph using a different projection that might inherently reduce scapular overlap, without specifically addressing the positioning issues of the initial image. Option B. Accept the image as it is, given the patient's discomfort and the visualization of the majority of the lung fields, to minimize radiation exposure from a repeat examination. Option C. Reevaluate the positioning to minimize scapular overlap and improve visualization of the lung apices, potentially by adjusting patient position or tube angle, while ensuring collimation is appropriate for the area of interest. Option D. Adjust the image processing parameters to enhance the visibility of the lung apices, assuming this will compensate for any positioning deficiencies. The correct answer is C. Reevaluate the positioning to minimize scapular overlap and improve visualization of the lung apices, potentially by adjusting patient position or tube angle, while ensuring collimation is appropriate for the area of interest. Explanation. Scenario analysis. This scenario presents a common implementation challenge in medical imaging, ensuring diagnostic quality while managing patient comfort and radiation dose. Technologists must critically evaluate the radiographic image for anatomical accuracy and positioning, which directly impacts the diagnostic utility of the image. Failure to achieve optimal positioning can lead to misdiagnosis or the need for repeat imaging, increasing patient radiation exposure and healthcare costs. The challenge lies in balancing the technical requirements of radiography with the patient's physical limitations and the need for efficient workflow. Correct approach analysis. The correct approach involves a thorough assessment of the radiographic image against established anatomical landmarks and positioning criteria for the specific examination. This includes verifying the correct centering of the anatomy of interest, appropriate collimation, absence of rotation or distortion, and adequate penetration. This meticulous review ensures that the image meets the diagnostic requirements as outlined by the Medical Radiation Technologists Board's professional standards and guidelines for image quality and patient care. Adhering to these standards is paramount for providing safe and effective diagnostic imaging services. Incorrect approaches analysis. One incorrect approach would be to accept an image that is marginally positioned, but appears good enough, without a critical evaluation of anatomical detail and alignment. This fails to uphold the professional responsibility to produce images of the highest diagnostic quality, potentially leading to diagnostic errors and violating the board's expectations for competent practice. It also disregards the principle of ALARA, as low as reasonably achievable, by risking repeat exposures due to suboptimal initial imaging. Another incorrect approach would be to prioritize patient comfort or speed of examination over achieving correct radiographic positioning. Patient well-being is crucial. It should not compromise the fundamental requirement for diagnostic accuracy. An improperly positioned image, even if obtained quickly and comfortably, is not diagnostically useful and necessitates repeat imaging, thereby increasing the patient's overall radiation dose and potentially delaying diagnosis. This approach demonstrates a failure to adhere to the core competencies expected of a medical radiation technologist. A further incorrect approach would be to rely solely on automated positioning systems without independent verification. While technology can assist, the technologist remains ultimately responsible for the quality of the image produced. Over-reliance on automation without critical assessment can lead to undetected errors in positioning, especially in cases of patient anatomy variations or equipment malfunction, thus failing to meet the professional standards of care mandated by the board. Professional reasoning. Medical radiation technologists must employ a systematic decision-making process that begins with understanding the clinical indication for the examination and the specific anatomical structures to be visualized. This is followed by applying knowledge of radiographic anatomy and positioning principles, selecting appropriate technical factors, and executing the examination. Crucially, a critical evaluation of the resultant image is the final step. This evaluation should be based on established criteria for image quality, anatomical accuracy, and absence of artifacts. If the image does not meet these standards, the technologist must identify the specific positioning errors and implement corrective measures, always considering patient safety and radiation dose optimization. This iterative process ensures that diagnostic images are consistently produced, upholding professional accountability and patient care standards. Question 4. Consider a scenario where a newly qualified medical radiation technologist is asked to explain the fundamental difference in radiation type between a diagnostic ultrasound examination and a diagnostic X-ray examination to a concerned patient. Which of the following explanations most accurately reflects the distinction and adheres to professional standards? Option A. Diagnostic ultrasound uses a form of non-ionizing radiation. Diagnostic X-rays also use non-ionizing radiation, just at a higher energy level. Option B. Diagnostic ultrasound uses a type of radiation that is not well understood but is considered safe, whereas diagnostic X-rays are known to be ionizing radiation. Option C. Both diagnostic ultrasound and diagnostic X-rays use forms of radiation that can cause cellular damage and require the same strict shielding protocols. Option D. Diagnostic ultrasound uses sound waves, which are a form of non-ionizing radiation, while diagnostic X-rays use electromagnetic radiation that has enough energy to ionize atoms and molecules. The correct answer is D. Diagnostic ultrasound uses sound waves, which are a form of non-ionizing radiation, while diagnostic X-rays use electromagnetic radiation that has enough energy to ionize atoms and molecules. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misclassification of radiation types, which has direct implications for patient safety, equipment selection, and regulatory compliance. A medical radiation technologist, MRT, must possess a thorough understanding of the fundamental differences between ionizing and non-ionizing radiation to ensure appropriate diagnostic and therapeutic procedures are employed and that safety protocols are correctly implemented. The challenge lies in applying this theoretical knowledge to a practical situation where the distinction might not be immediately obvious, or where there's a risk of conflating different radiation principles. Correct approach analysis. The correct approach involves accurately identifying the radiation type based on its interaction with matter and its energy levels. Ionizing radiation, such as X-rays and gamma rays, possesses sufficient energy to remove electrons from atoms and molecules, thereby directly causing cellular damage. Non-ionizing radiation, like radiofrequency waves or visible light, does not have enough energy to ionize atoms. A technologist demonstrating best professional practice would correctly categorize diagnostic ultrasound as utilizing non-ionizing radiation. This aligns with the Medical Radiation Technologists Board's MRT Board guidelines on scope of practice and safe use of diagnostic imaging modalities, emphasizing the need for accurate knowledge of the physical principles underlying each technology. This ensures that appropriate safety measures, which differ significantly between the two radiation types, are applied. Incorrect approaches analysis. One incorrect approach would be to assume that all forms of radiation used in medical imaging are inherently dangerous and require the same stringent radiation protection measures as ionizing radiation. This demonstrates a failure to differentiate between ionizing and non-ionizing radiation, leading to unnecessary patient anxiety and potentially inefficient workflow. Ethically, it breaches the principle of beneficence by not providing accurate information and potentially causing undue harm through fear. From a regulatory perspective, it shows a lack of understanding of the specific requirements for each modality as outlined by the MRT board. Another incorrect approach would be to classify diagnostic ultrasound as a form of ionizing radiation. This is a critical error that misunderstands the fundamental physics of ultrasound, which relies on sound waves, not electromagnetic radiation capable of ionization. This misclassification would lead to the application of incorrect safety protocols, potentially exposing patients and staff to inappropriate shielding or monitoring, and failing to adhere to the specific regulatory requirements for ultrasound equipment and procedures. It represents a significant failure in professional competence and adherence to the MRT board standards for safe practice. A further incorrect approach might involve treating diagnostic ultrasound as a modality that requires no safety considerations whatsoever, simply because it is non-ionizing. While the risks are different from ionizing radiation, ultrasound does have biological effects, and responsible practice involves understanding these effects and adhering to established safety guidelines for its use, such as minimizing exposure time and intensity when clinically appropriate. This approach fails to uphold the principle of non-maleficence by neglecting potential, albeit different, risks. Professional reasoning. Professionals should approach such situations by first recalling the fundamental definitions and properties of ionizing and non-ionizing radiation. They should then consider the physical mechanism by which the specific medical imaging modality operates. If there is any uncertainty, consulting reliable resources such as the MRT board's official guidelines, peer-reviewed literature, or experienced colleagues is crucial. The decision-making process should prioritize patient safety, accurate diagnosis, and adherence to regulatory standards, ensuring that the correct type of radiation is identified and managed according to its specific properties and associated risks. Question 5. The investigation demonstrates that a patient undergoing a diagnostic imaging procedure has received an absorbed dose of 5 gray Gi of X-rays. When asked by the patient about the implications of this dose, what is the most appropriate and informative response for the medical radiation technologist to provide, adhering to the principles of radiation protection and patient communication? Option A. Inform the patient that 5 gray is equivalent to 5 sievert, as both units measure radiation exposure. Option B. State that the absorbed dose is 5 gray, which is a measure of the energy deposited in the tissue. Option C. Reassure the patient that the dose is within acceptable limits without detailing the specific units or their implications. Option D. Explain that while the absorbed dose is 5 gray, the equivalent dose, which accounts for the biological effectiveness of X-rays, is also considered to be 5 sievert SV, and is used to estimate the risk of stochastic effects. The correct answer is D. Explain that while the absorbed dose is 5 gray, the equivalent dose, which accounts for the biological effectiveness of X-rays, is also considered to be 5 sievert SV, and is used to estimate the risk of stochastic effects. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical radiation technologist, MRT, to interpret and communicate information about radiation exposure in a way that is both scientifically accurate and understandable to a patient. The MRT must navigate the distinction between absorbed dose and equivalent dose, understanding that different types of radiation have varying biological effects, even if the absorbed dose is the same. Miscommunication or misunderstanding of these units can lead to patient anxiety, distrust, or incorrect assumptions about their health risks. Correct approach analysis. The correct approach involves clearly explaining that while the absorbed dose, measured in gray, quantifies the energy deposited in tissue, the equivalent dose, measured in sievert, accounts for the biological effectiveness of different radiation types. This distinction is crucial for patient understanding of potential biological harm. By stating that the sievert is used to estimate the risk of stochastic effects, the MRT is accurately reflecting the regulatory framework's emphasis on biological risk assessment for radiation protection, aligning with principles of informed consent and patient safety, as outlined by the Medical Radiation Technologists Board. Incorrect approaches analysis. One incorrect approach is to simply state the gray value without further explanation. This fails to address the biological implications of the exposure, which is the primary concern for the patient and the focus of radiation protection regulations. It is a technically correct measurement, but lacks the necessary context for patient comprehension and risk assessment. Another incorrect approach is to equate gray and sievert directly, implying they are interchangeable. This is a fundamental misunderstanding of radiation dosimetry and a direct contravention of the principles of radiation protection that differentiate between physical energy deposition and biological risk. Such an approach would mislead the patient about the potential harm. A third incorrect approach is to focus solely on the technical measurement without acknowledging the patient's potential concern about health effects. While accurate, it neglects the ethical obligation to provide clear, understandable information that addresses the patient's likely anxieties regarding radiation exposure. This fails to uphold the professional standard of patient-centered care, Professional reasoning. When communicating radiation exposure to patients, MRTs should adopt a patient-centered approach. This involves 1. Understanding the patient's existing knowledge and concerns. 2. Using clear, non-technical language where possible or explaining technical terms simply. 3. Differentiating between physical measurements, like gray, and biological risk estimates, like Sievert. 4. Emphasizing that radiation protection principles are in place to minimize risk. 5. Being prepared to answer questions honestly and reassuringly within the scope of their professional practice. This process ensures that patients are informed, empowered, and less likely to experience undue anxiety. Question 6. Upon reviewing the patient's scan request for a chest X-ray, the medical radiation technologist, MRT, considers the primary interaction mechanisms of X-rays with the lung and bone tissues. Which approach best reflects the MRT's understanding of radiation interaction with matter to optimize image quality and minimize patient dose? Option A. Relying solely on the default exposure settings programmed into the X-ray equipment without any adjustment for specific tissue types. Option B. Consistently using the highest possible kilovoltage, kVp, to ensure maximum penetration through all tissues, regardless of their composition. Option C. Prioritizing the lowest possible milliampere seconds m as to minimize patient dose, even if it results in a noisy or low-contrast image. Option D. Selecting exposure factors that leverage the photoelectric effect for bone and Compton scattering for lung tissue to achieve optimal contrast and penetration. The correct answer is D. Selecting exposure factors that leverage the photoelectric effect for bone and Compton scattering for lung tissue to achieve optimal contrast and penetration. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the medical radiation technologist, MRT, to interpret and apply knowledge of radiation interaction with matter in a practical clinical context, specifically concerning patient safety and image quality. The MRT must understand how different tissues absorb and interact with radiation to select appropriate exposure factors and positioning, thereby minimizing unnecessary dose while achieving diagnostic efficacy. The challenge lies in translating theoretical physics into concrete actions that directly impact patient care and diagnostic outcomes. Correct approach analysis. The correct approach involves selecting exposure factors that optimize the photoelectric effect and Compton scattering for the specific tissue being imaged. This is best professional practice because it aligns with the fundamental principles of radiation physics and their application in diagnostic imaging. By understanding that photoelectric effect is dominant in high atomic number materials and at lower energies, and Compton scattering is more prevalent in lower atomic number materials and at higher energies, the MRT can tailor the exposure to enhance contrast, photoelectric effect, or penetrate tissue Compton scattering appropriately. This directly supports the ALARA, as low as reasonably achievable, principle by ensuring the minimum dose necessary for a diagnostic image, as mandated by professional standards and regulatory guidelines for MRTs. This approach prioritizes both patient safety and diagnostic quality, which are core ethical and professional responsibilities. Incorrect approaches analysis. One incorrect approach would be to solely rely on default equipment settings without considering the specific tissue characteristics. This fails to acknowledge the differential interaction of radiation with matter, potentially leading to overexposure or underexposure, compromising image quality and increasing patient dose unnecessarily. This is a failure to apply professional judgment and adhere to the principles of radiation physics, which could be considered a breach of professional duty of care. Another incorrect approach would be to prioritize image penetration above all else, regardless of the tissue type. This might involve consistently using high kVp settings, which would increase Compton scattering. While this can improve penetration, it can also reduce contrast and increase scatter radiation, potentially degrading image quality and increasing patient dose without a clear diagnostic benefit. This demonstrates a misunderstanding of how to optimize the balance between different interaction mechanisms for specific diagnostic tasks. A further incorrect approach would be to focus solely on minimizing patient dose by using extremely low exposure factors without considering the resulting image quality. While dose reduction is crucial, diagnostic images must be of sufficient quality to be interpreted by a radiologist. If the image is too noisy or lacks adequate contrast due to insufficient radiation, it may be non-diagnostic, requiring repeat examinations, and thus increasing the overall patient dose and delaying diagnosis. This approach neglects the dual responsibility of the MRT to ensure both safety and diagnostic efficacy. Professional reasoning. Professionals should employ a decision-making framework that begins with understanding the diagnostic objective and the anatomical region being imaged. This involves recalling or assessing the primary tissue composition and density. Subsequently, the MRT should consider how different radiation interaction mechanisms, photoelectric effect, Compton scattering, coherent scattering, pair production, will manifest in that specific tissue at various energy levels. Based on this understanding, they should select exposure factors, KVP, MS, and filtration that optimize the desired interaction for image formation while minimizing patient dose. This iterative process of assessment, application of physical principles, and adjustment ensures that both image quality and patient safety are paramount, aligning with regulatory requirements for competent practice. Question 7. System analysis indicates a patient undergoing a chest radiograph is experiencing significant discomfort in the standard erect AP projection due to a recent injury. The technologist has assessed that the patient's discomfort is likely to cause involuntary movement, potentially compromising image quality. Which of the following approaches best adheres to the Medical Radiation Technologists Board's regulatory framework and professional standards? Option A. Proceed with the standard AP projection without modification, instructing the patient to hold still despite their discomfort to ensure adherence to the prescribed protocol. Option B. Increase the radiation dose significantly to compensate for anticipated patient movement, prioritizing image acquisition over patient comfort and radiation optimization. Option C. Attempt to modify exposure factors, KVP, MS, and explore minor positional adjustments to achieve diagnostic image quality while minimizing patient discomfort, communicating with the patient throughout the process. Option D. Terminate the examination immediately due to the patient's discomfort, advising the patient to return when they are able to tolerate the standard positioning. The correct answer is C. Attempt to modify exposure factors, KVP, MS, and explore minor positional adjustments to achieve diagnostic image quality while minimizing patient discomfort, communicating with the patient throughout the process. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between patient comfort and the diagnostic quality required for accurate radiographic interpretation. The technologist must balance the patient's immediate discomfort with the long-term need for a clear diagnostic image, which directly impacts patient care and potential treatment. This requires a nuanced understanding of radiographic principles and the ability to adapt techniques within regulatory guidelines. Correct approach analysis. The correct approach prioritizes achieving diagnostic image quality while minimizing patient discomfort through appropriate technique modification. This aligns with the Medical Radiation Technologists Board's MRTB Code of Conduct, which mandates providing high-quality patient care and ensuring diagnostic efficacy. Modifying exposure factors, KVP, MS, and potentially adjusting positioning within the bounds of diagnostic acceptability demonstrates professional competence and adherence to best practice. This approach ensures the image is diagnostically useful, thereby fulfilling the primary objective of the examination and avoiding the need for repeat imaging, which exposes the patient to unnecessary radiation. Incorrect approaches analysis. Failing to obtain a diagnostically adequate image due to patient discomfort and proceeding with the examination without attempting any modifications represents a failure to uphold the MRTB standards for patient care and diagnostic imaging. This could lead to misdiagnosis or delayed diagnosis, directly impacting patient outcomes. Similarly, resorting to excessive radiation doses to overcome patient movement or suboptimal positioning, without first exploring technique adjustments or alternative positioning, violates the principle of ALARA, as low as reasonably achievable, and the MRTB guidelines on radiation protection. Another incorrect approach would be to dismiss the patient's discomfort entirely and force them into a position that causes significant pain, potentially leading to patient complaints and breaches of professional conduct related to patient dignity and respect. Professional reasoning. Professionals facing this situation should employ a systematic decision-making process. First, assess the patient's stated discomfort and its potential impact on image quality. Second, consult established radiographic protocols and consider permissible technique modifications that can maintain diagnostic quality. Third, communicate with the patient, explaining the necessity of certain positions or techniques and exploring collaborative solutions. Fourth, if modifications are insufficient, consider alternative imaging modalities or consult with a radiologist for guidance. This iterative process ensures that patient well-being and diagnostic accuracy are both prioritized within the regulatory framework. Question 8. Examination of the data shows that a medical radiation technologist is reviewing a digital radiograph of the chest and observes that the image exhibits poor contrast, making it difficult to differentiate between lung parenchyma and surrounding structures, and a noticeable level of noise, obscuring fine details. The technologist has adjusted the exposure factors, KVP and M, as in previous attempts to improve the image. Considering the factors affecting image quality, which approach best addresses the observed issues while adhering to professional standards for diagnostic imaging? Option A. Reduce KVP to increase subject contrast, and then increase M as to compensate for the reduced photon output, accepting that this may increase scatter and potentially introduce more noise. Option B. Systematically evaluate the impact of increasing KVP to improve penetration and potentially reduce scatter, while simultaneously assessing how increasing M as affects noise reduction and overall contrast, making incremental adjustments to achieve optimal diagnostic quality with minimal dose. Option C. Increase KVP significantly to enhance penetration and reduce scatter, then adjust M as to compensate for any resulting overexposure, aiming to improve contrast and reduce noise. Option D. Primarily focus on increasing M as to reduce quantum noise, assuming that a lower noise level will inherently improve contrast and resolution, without further consideration of KVP adjustments. The correct answer is C. Increase KVP significantly to enhance penetration and reduce scatter, then adjust M as to compensate for any resulting overexposure, aiming to improve contrast and reduce noise. Explanation. Scenario analysis. This scenario presents a common challenge in medical radiation technology, optimizing image quality while managing patient dose. The technologist must critically evaluate different imaging parameters and their impact on contrast, resolution, and noise. This requires a deep understanding of the underlying physics of image formation and the specific capabilities of the imaging equipment, balanced against the need to obtain diagnostic information without unnecessary radiation exposure. The challenge lies in making informed decisions that directly affect patient care and diagnostic accuracy, necessitating a thorough grasp of the Medical Radiation Technologists Board's MRTB standards. Correct approach analysis. The correct approach involves a systematic evaluation of how manipulating KVP and M as affects the image. Increasing KVP generally increases penetration and can improve contrast by reducing scatter, but it can also decrease subject contrast if the difference in attenuation between tissues becomes too small. Increasing M as increases the number of photons, which primarily reduces quantum model noise, thereby improving resolution and potentially contrast by making subtle differences more apparent. A balanced approach that considers the interplay between these factors to achieve optimal contrast, adequate resolution, and acceptable noise levels, while minimizing patient dose, represents best professional practice. This aligns with MRTB guidelines that emphasize the production of diagnostic quality images with the lowest practicable dose. Incorrect approach is analysis. One incorrect approach would be to solely focus on increasing M as to reduce noise without considering the impact on contrast and patient dose. This could lead to an overexposed image with reduced contrast and unnecessary radiation exposure, failing to meet diagnostic requirements and violating the principle of ALARA, as low as reasonably achievable, as mandated by MRTB standards. Another incorrect approach would be to solely focus on increasing KVP to improve penetration and reduce scatter, without considering the potential for decreased subject contrast and increased dose. If KVP is increased too much for a given examination, the differential attenuation between tissues may be insufficient to generate adequate contrast, rendering the image diagnostically suboptimal and potentially leading to repeat exposures, thus increasing overall patient dose. A third incorrect approach would be to ignore the interplay between KVP and M as making arbitrary adjustments. This demonstrates a lack of understanding of fundamental radiographic principles and can lead to consistently suboptimal image quality, increased patient dose, and a failure to adhere to professional standards of practice expected by the MRTB. Professional reasoning. Professionals should approach image quality optimization by first understanding the diagnostic task and the anatomical region being imaged. They should then consider the fundamental relationships between KVP, M as contrast, resolution, and noise. A systematic approach involves 1. Establishing baseline parameters for the examination. 2. Evaluating the initial image for contrast, resolution, and noise. 3. Making targeted adjustments to KVP and or M as based on the observed deficiencies, always considering the impact on patient dose. 4. Repeating the evaluation process until diagnostic quality is achieved with the lowest practicable dose. This iterative process, guided by knowledge of the imaging system and regulatory requirements, ensures optimal patient care and adherence to professional standards. Question 9. Performance analysis shows a medical radiation technologist has acquired images of a patient's chest for suspected pneumonia. During the review of the images, an unexpected, well-defined nodule is identified in the periphery of the lung, which is not related to the suspected pneumonia. The technologist is aware that reporting such incidental findings is part of their professional responsibility, but also understands the importance of not overstepping their diagnostic capabilities. What is the most appropriate action for the medical radiation technologist to take regarding this incidental finding? Option A. Document the incidental lung nodule in the imaging report, describing its location and characteristics, and recommend further evaluation by a qualified medical practitioner. Option B. Omit any mention of the lung nodule from the report to avoid causing unnecessary patient anxiety, as it is not related to the primary reason for the examination. Option C. Provide a preliminary interpretation of the lung nodule, suggesting it is likely benign, to reassure the patient. Option D. Discuss the incidental lung nodule directly with the patient, advising them to schedule a follow-up appointment with their general practitioner for further investigation. The correct answer is A. Document the incidental lung nodule in the imaging report, describing its location and characteristics, and recommend further evaluation by a qualified medical practitioner. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpretation of anatomical findings and the ethical obligation to maintain patient confidentiality and professional integrity. The technologist is faced with an incidental finding that, while not directly related to the primary imaging request, could have significant implications for the patient's health. The challenge lies in balancing the immediate need for accurate reporting with the potential for causing undue patient anxiety or overstepping professional boundaries. Careful judgment is required to determine the appropriate course of action, ensuring patient well-being and adherence to professional standards. Correct approach analysis. The correct approach involves documenting the incidental finding accurately in the report, clearly stating its location and apparent characteristics without making a definitive diagnosis. This approach upholds the technologist's professional responsibility to report all relevant observations. It aligns with the Medical Radiation Technologists Board's guidelines on professional conduct and scope of practice, which emphasize accurate data collection and reporting. By documenting the finding and recommending further evaluation by a qualified medical practitioner, the technologist ensures the patient receives appropriate medical attention without exceeding their role as a diagnostic imaging professional. This respects the patient's right to information while maintaining the integrity of the diagnostic process. Incorrect approaches analysis. One incorrect approach is to ignore the incidental finding entirely. This is a failure to adhere to professional duty of care. The Medical Radiation Technologists Board expects technologists to report all significant findings, even if they are incidental. Failing to do so could lead to delayed diagnosis and treatment for the patient, constituting professional negligence. Another incorrect approach is to attempt to diagnose the incidental finding. This oversteps the technologist's scope of practice. Medical radiation technologists are trained to acquire and process images and to report observations, but not to provide medical diagnoses. Diagnosing falls under the purview of radiologists and other medical practitioners. Attempting to diagnose would violate regulatory frameworks governing the practice of medical radiation technology and could lead to misdiagnosis and harm to the patient. A third incorrect approach is to discuss the incidental finding directly with the patient without consulting a radiologist or referring physician. While transparency is important, discussing a potentially serious incidental finding without proper context or a confirmed diagnosis can cause significant patient distress and anxiety. It also bypasses the established communication channels within the healthcare team, potentially undermining the diagnostic process and the roles of other healthcare professionals. This could be seen as a breach of professional conduct and patient communication protocols. Professional reasoning. Professionals should approach such situations by first recognizing the incidental finding and its potential significance. The next step is to consult the relevant imaging protocols and professional guidelines from the Medical Radiation Technologists Board. The technologist should then accurately document the finding in the imaging report, noting its location and characteristics objectively. Crucially, the report should recommend that the finding be reviewed by a qualified medical practitioner, such as a radiologist or the referring physician, for further assessment and diagnosis. This ensures that the patient's care is managed by the appropriate professionals within their respective scopes of practice, while also fulfilling the technologist's reporting obligations. Question 10. Cost-benefit analysis shows that a new fluoroscopy unit offers significant improvements in image resolution, potentially leading to more accurate diagnoses and reduced repeat procedures. However, the unit also operates at higher energy levels than the previous model. What is the most appropriate initial action for the medical radiation technologist to take to ensure compliance with radiation protection standards and regulations? Option A. Consult the manufacturer's technical specifications for radiation output and safety features, review relevant national radiation safety guidelines, and propose updates to local rules and protocols to incorporate the ALARA principle for the new equipment. Option B. Commence routine use of the new fluoroscopy unit immediately, assuming it meets all regulatory requirements due to its recent approval and advanced technology. Option C. Rely solely on the manufacturer's provided training materials for operational use and radiation safety, without further independent verification of the unit's radiation characteristics. Option D. Prioritize patient throughput and diagnostic efficiency, deferring any detailed review of radiation output or protocol updates until a potential issue arises. The correct answer is A. Consult the manufacturer's technical specifications for radiation output and safety features, review relevant national radiation safety guidelines, and propose updates to local rules and protocols to incorporate the ALARA principle for the new equipment. Explanation. Scenario analysis. This scenario presents a professional challenge where a medical radiation technologist, MRT, must balance the immediate need for diagnostic imaging with the long-term principles of radiation protection. The introduction of new equipment, while potentially improving diagnostic quality, also introduces new variables in radiation exposure. The MRT's responsibility extends beyond simply operating the equipment to ensuring that all radiation practices adhere to established safety standards, minimizing dose to patients and themselves without compromising diagnostic efficacy. This requires a proactive and informed approach to risk assessment and management. Correct approach analysis. The correct approach prioritizes a thorough review of the new equipment's radiation output and the implementation of updated local rules and protocols based on the ALARA, as low as reasonably achievable, principle. This aligns directly with the fundamental tenets of radiation protection as mandated by regulatory bodies overseeing medical radiation practice. By consulting the manufacturer's specifications, reviewing relevant national radiation safety guidelines, such as those from the Health and Safety Executive in the UK, if applicable to the specified jurisdiction, and updating local protocols, the MRT demonstrates a commitment to patient and staff safety. This proactive measure ensures that the introduction of new technology is managed responsibly, minimizing unnecessary radiation exposure and adhering to legal and ethical obligations. Incorrect approach is analysis. One incorrect approach involves proceeding with routine use of the new equipment without a formal review of its radiation characteristics. This fails to uphold the ALARA principle and the regulatory requirement to assess and control radiation risks. It represents a passive acceptance of potential overexposure, which is a direct contravention of professional duty and regulatory oversight. Another incorrect approach is to rely solely on the manufacturer's general training, without independently verifying the equipment's performance against established safety benchmarks and local conditions. While manufacturer training is valuable, it may not encompass the specific nuances of the clinical environment or the most current local regulatory interpretations. This approach risks overlooking potential deviations or specific risks not highlighted in generic training. A third incorrect approach is to assume that because the equipment is new and approved, it automatically meets all radiation protection standards without further verification. Regulatory approval signifies that the equipment design meets certain standards, but its actual performance in a clinical setting and its integration into existing workflows requires ongoing assessment and adherence to established radiation protection protocols. This assumption neglects the MRT's active role in ensuring safe practice. Professional reasoning. Professionals in medical radiation technology must adopt a systematic approach to managing radiation safety. This involves 1. Understanding the regulatory framework governing radiation protection in their jurisdiction. 2. Proactively assessing risks associated with new equipment or procedures. 3. Implementing and adhering to the ALARA principle in all practices. 4. Documenting and reviewing radiation safety protocols regularly. 5. Engaging in continuous professional development to stay abreast of evolving standards and technologies. When faced with new technology, the decision-making process should involve a risk-benefit assessment that explicitly considers radiation dose, diagnostic benefit, and the implementation of appropriate protective measures, all within the established regulatory guidelines. Question 11. Analysis of the fundamental concepts of radiation quality and quantity in diagnostic imaging. A medical radiation technologist is tasked with imaging a pediatric patient's chest. The technologist has the option to utilize a higher kilovoltage peak, kVp setting, which would result in a lower patient dose but potentially reduced contrast, or a lower kVp setting, which would increase contrast but also increase patient dose. Considering the principles of radiation interaction with tissue and image receptor response, which approach best aligns with the dual objectives of diagnostic efficacy and radiation safety. Option A. Rely solely on the automatic exposure control (EC) system to determine the optimal kVp and MS, without independent consideration of radiation quality and quantity principles. Option B. Employ the highest possible kVp setting to minimize patient dose, even if it significantly reduces image contrast and potentially obscures subtle pathologies. Option C. Select a kVp setting that provides adequate penetration for the chest anatomy, ensuring sufficient contrast for visualization of lung fields and mediastinal structures, while adjusting milliampereseconds m as to maintain an appropriate radiation dose according to ALARA principles. Option D. Utilize the lowest possible kVp setting to maximize image contrast, accepting a higher patient dose as a necessary trade-off for a diagnostically superior image. Correct answer is C. Select a kVp setting that provides adequate penetration for the chest anatomy, ensuring sufficient contrast for visualization of lung fields and mediastinal structures, while adjusting milliampereseconds m as to maintain an appropriate radiation dose according to ALARA principles. Explanation. This scenario is professionally challenging because it requires a medical radiation technologist, MRT, to apply fundamental radiation concepts to a practical patient care situation, balancing diagnostic imaging needs with radiation safety principles. The MRT must understand the implications of different radiation qualities on image formation and patient dose, demonstrating a commitment to ALARA as low as reasonably achievable, while ensuring diagnostic efficacy. The correct approach represents best professional practice because it prioritizes patient well-being and diagnostic image quality by selecting the most appropriate radiation quality for the specific anatomical region and clinical indication. This aligns with the Medical Radiation Technologists Board's regulatory framework, which mandates competent practice, adherence to radiation safety standards, and the provision of high-quality diagnostic imaging. Specifically, it reflects the ethical obligation to minimize patient dose without compromising diagnostic information, a core tenet of professional responsibility. An incorrect approach that prioritizes speed over appropriate technique would fail to meet the diagnostic requirements and could lead to unnecessary patient exposure, violating radiation safety regulations and ethical guidelines. Another incorrect approach that overcompensates by using excessively high radiation quality, even if it produces a technically acceptable image, would also be a failure. This is because it unnecessarily increases patient dose beyond what is reasonably achievable for diagnostic purposes, contravening the ALARA principle and potentially exposing the patient to higher risks without commensurate benefit. A third incorrect approach that relies solely on automatic exposure control without understanding the underlying principles of radiation quality and its impact on image receptor exposure would be a failure of professional judgment. While AEC can be a useful tool, it should be used in conjunction with an understanding of radiation physics and its interaction with tissues and image receptors, not as a substitute for professional knowledge and decision-making. Professionals should approach such situations by first considering the clinical question and the anatomical region being imaged. They should then evaluate the available imaging parameters, understanding how factors like kilovoltage peak, kVp, and milliampere seconds m as influence radiation quality, quantity, and ultimately image contrast and noise. The decision-making process should involve a deliberate selection of parameters that optimize the signal-to-noise ratio for the specific diagnostic task while adhering to ALARA principles, consulting departmental protocols, and considering patient-specific factors. Question 12. Compliance review shows a medical radiation technologist, MRT, is performing a chest X-ray on a patient. During the exposure, the MRT observes the patient taking shallow, rapid breaths and notes a noticeable upward movement of the patient's shoulders rather than the expected downward excursion of the diaphragm. Considering the anatomical structures of the respiratory system and their relationship to the thoracic cavity, what is the most appropriate immediate action for the MRT to take? Option A. Continue the exposure as scheduled, assuming the patient's breathing will stabilize during the procedure. Option B. Immediately terminate the procedure and inform the referring physician of the patient's apparent distress. Option C. Instruct the patient to hold their breath forcefully, regardless of their comfort level, to achieve a still image. Option D. Pause the exposure and reassess the patient's breathing pattern, considering the impact of diaphragmatic movement on lung inflation and image clarity. The correct answer is D. Pause the exposure and reassess the patient's breathing pattern, considering the impact of diaphragmatic movement on lung inflation and image clarity. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical radiation technologist, MRT, to interpret a patient's physiological response in the context of their anatomical knowledge, specifically concerning the respiratory system. Misinterpreting the patient's breathing pattern could lead to incorrect imaging protocols, potentially compromising diagnostic accuracy and patient safety. The MRT must balance the need for diagnostic imaging with the patient's immediate comfort and physiological status, demonstrating a nuanced understanding of both anatomy and patient care. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing patient well-being and diagnostic integrity. The MRT's action of pausing the procedure to assess the patient's breathing pattern, recognizing the potential impact of diaphragmatic excursion on the thoracic anatomy, directly aligns with the Medical Radiation Technologists Board's MRT Board guidelines on patient care and professional conduct. This proactive assessment ensures that the imaging is performed under optimal physiological conditions, minimizing artifacts and maximizing diagnostic yield. It reflects a commitment to evidence-based practice and patient-centered care, which are fundamental ethical and professional obligations for MRTs. Incorrect approach is analysis, an approach that involves continuing the procedure without assessing the patient's breathing pattern fails to acknowledge the dynamic nature of the respiratory system and its impact on imaging. This could lead to diagnostic errors due to motion artifacts or suboptimal positioning, violating the MRT board standards for image quality and patient safety. It demonstrates a lack of critical thinking and a failure to adapt to the patient's immediate physiological state. An approach that involves immediately terminating the procedure without a thorough assessment of the breathing pattern might be an overreaction. While patient safety is paramount, a hasty termination could lead to unnecessary repeat examinations, increased radiation exposure, and patient anxiety. This approach fails to apply professional judgment in determining the necessity and appropriate course of action based on the observed physiological signs. An approach that involves relying solely on the referring physician's initial instructions without considering the patient's current physiological presentation overlooks the MRT's responsibility to monitor and adapt imaging techniques. The MRT has a professional duty to ensure the quality and appropriateness of the imaging being performed, which includes assessing the patient's condition during the procedure. This approach could lead to suboptimal imaging if the patient's respiratory status has changed since the referral. Professional reasoning. MRTs must employ a systematic decision-making process that integrates anatomical knowledge, understanding of physiological processes, and patient assessment. This involves 1. Initial assessment of the patient and review of the referral. 2. Continuous monitoring of the patient's physiological status during the procedure. 3. Application of anatomical and physiological knowledge to interpret observed signs. 4. Critical evaluation of the impact of these signs on image acquisition. 5. Professional judgment to modify the procedure, pause, or terminate as necessary to ensure diagnostic quality and patient safety, in accordance with MRT board regulations. Question 13. Strategic planning requires medical radiation technologists to proactively consider the impact of radiation dose on patient outcomes. When faced with a situation where a standard imaging protocol might deliver a higher dose than necessary for a particular patient, what is the most appropriate course of action to ensure optimal patient care and regulatory compliance? Option A. Adjust imaging parameters based on a clinical assessment of the patient size and the specific diagnostic question, utilizing dose reduction techniques where appropriate, while ensuring diagnostic image quality is maintained. Option B. Rely on the referring clinician's judgment for dose management and proceed with the examination as requested without further consideration of dose optimization. Option C. Proceed with the standard imaging protocol without modification to ensure consistency and avoid potential diagnostic errors, assuming the dose is within acceptable limits. Option D. Significantly reduce exposure factors to minimize dose, even if it compromises the diagnostic quality of the image, as dose reduction is the absolute priority. Correct answer is A. Adjust imaging parameters based on a clinical assessment of the patient's size and the specific diagnostic question, utilizing dose reduction techniques where appropriate, while ensuring diagnostic image quality is maintained. Explanation. This scenario is professionally challenging because it requires the medical radiation technologist, MRT, to balance the immediate need for diagnostic imaging with the fundamental principle of radiation protection, specifically minimizing patient dose. The MRT must exercise professional judgment to ensure that the diagnostic benefit outweighs the radiation risk, adhering to the ALARA, as low as reasonably achievable principle. This involves understanding the implications of radiation dose on patient outcomes and the regulatory expectations for dose management. The correct approach represents best professional practice because it prioritizes patient safety and adheres to the core tenets of radiation protection as mandated by the Medical Radiation Technologists Board's regulatory framework. This involves a thorough assessment of the clinical indication, the selection of appropriate imaging parameters, and the use of dose reduction techniques where feasible, all while ensuring diagnostic image quality is maintained. This aligns with the board's emphasis on professional accountability and the ethical obligation to protect patients from unnecessary radiation exposure. An incorrect approach that focuses solely on obtaining the image as quickly as possible without considering dose implications fails to uphold the ALARA principle. This could lead to unnecessary radiation exposure for the patient, potentially increasing their lifetime risk of stochastic effects, and would be a breach of the MRT's professional and ethical responsibilities. Another incorrect approach that involves arbitrarily reducing exposure factors without a clinical justification or assessment of image quality compromises the diagnostic integrity of the examination. This not only fails to provide useful clinical information, but also exposes the patient to radiation without a commensurate benefit, which is contrary to the principles of justification and optimization. An approach that relies on assumptions about patient size or condition without verification, and consequently uses inappropriate exposure settings, demonstrates a lack of due diligence and a failure to apply best practice in dose management. Professional reasoning in such situations requires a systematic approach. First, critically evaluate the clinical request to ensure the examination is justified. Second, consider the patient's specific characteristics, e.g., age, size, clinical history, that may influence dose. Third, select the most appropriate imaging protocol, optimizing parameters to achieve diagnostic image quality with the lowest achievable dose. Fourth, utilize available dose reduction technologies and techniques. Finally, document the rationale for the chosen parameters, particularly if deviations from standard protocols are made. This decision-making process ensures that patient care is prioritized while adhering to regulatory requirements and ethical standards. Question 14. Research into the properties of X-rays has led to advancements in diagnostic imaging. A medical radiation technologist is preparing to perform a chest X-ray on an adult patient. They are considering the impact of different exposure factors on the resulting image and the patient's radiation dose. Which of the following considerations best reflects the application of X-ray properties for optimal diagnostic imaging and patient safety, as guided by the Medical Radiation Technologists Board's regulatory framework? Option A. Adjusting the kilovoltage peak, kVp, to a very low level to reduce the overall energy of the X-ray beam, even if this results in a significantly underexposed image requiring repeat exposures. Option B. Selecting exposure factors that ensure maximum penetration of the X-ray beam to visualize subtle anatomical details, while also ensuring the overall radiation dose to the patient is minimized through appropriate collimation and filtration. Option C. Prioritizing the use of the highest possible X-ray beam intensity, MS, to achieve a very short exposure time, thereby reducing the likelihood of motion blur, regardless of the resulting dose. Option D. Relying solely on the default machine settings for a standard adult chest X-ray, assuming these are always optimized for every patient and clinical scenario. The correct answer is B. Selecting exposure factors that ensure maximum penetration of the X-ray beam to visualize subtle anatomical details, while also ensuring the overall radiation dose to the patient is minimized through appropriate collimation and filtration. Explanation. Scenario analysis. This scenario presents a professional challenge for a medical radiation technologist, MRT, due to the inherent properties of X-rays and their interaction with biological tissues. The challenge lies in balancing the diagnostic benefit of X-ray imaging with the potential for biological harm, requiring a nuanced understanding of X-ray properties to optimize patient care and safety. The MRT must apply their knowledge of X-ray physics to justify and execute imaging procedures responsibly, adhering to the principles of ALARA, as low as reasonably achievable, and radiation protection. Correct approach analysis. The correct approach emphasizes the MRT's responsibility to understand and apply the fundamental properties of X-rays to minimize patient dose while achieving diagnostic image quality. This aligns directly with the Medical Radiation Technologists Board's regulatory framework, which mandates that MRTs practice competently and ethically, prioritizing patient safety and well-being. Specifically, understanding how factors like kVp, MS, and filtration influence X-ray beam quality and quantity allows the MRT to select optimal exposure factors. This ensures that the X-ray beam is sufficiently penetrating and intense to produce a diagnostic image with the lowest possible radiation dose to the patient, thereby fulfilling the ethical obligation to avoid unnecessary harm and comply with radiation protection legislation. Incorrect approaches analysis. One incorrect approach focuses solely on achieving a technically perfect image without considering the radiation dose implications. This fails to uphold the ALARA principle, a cornerstone of radiation protection mandated by regulatory bodies. By prioritizing image perfection over dose optimization, the MRT risks delivering an unnecessarily high radiation dose to the patient, which is a direct contravention of their professional and legal obligations. Another incorrect approach involves relying on preset machine protocols without critical evaluation. While protocols are designed for efficiency, they may not always be appropriate for every patient's unique anatomy or clinical presentation. An MRT's professional responsibility includes adapting protocols based on their understanding of X-ray properties and patient factors. Blindly following a protocol without considering its suitability can lead to suboptimal imaging and or excessive radiation exposure, demonstrating a failure to exercise professional judgment and adhere to best practice guidelines. A third incorrect approach might involve prioritizing speed of examination over thorough understanding of X-ray interactions. While efficiency is important, it should never compromise patient safety or diagnostic efficacy. A rushed examination, driven by a lack of understanding of how X-ray properties affect image formation and biological effects, can lead to errors in technique, inadequate image quality, and potentially increased patient dose if repeat exposures are required. This demonstrates a lack of professional diligence and a disregard for the fundamental principles of radiation safety. Professional reasoning. Professionals should approach this situation by first identifying the core principles of radiation physics relevant to diagnostic imaging. This involves understanding the wave-particle duality of X-rays, their ability to ionize matter, and their penetration characteristics. The MRT must then consider how these properties are manipulated through exposure factors, KVP, M as distance, and beam modification, filtration, collimation to achieve a diagnostic image. The decision-making process should involve a systematic evaluation of the clinical indication, patient factors, age, size, condition, and the specific imaging modality. The goal is always to achieve the diagnostic objective with the lowest achievable radiation dose, adhering to regulatory requirements and ethical standards of practice. This requires continuous professional development and a commitment to evidence-based practice. Question 15. Operational review demonstrates that a patient scheduled for a pelvic ultrasound is expressing significant anxiety regarding the procedure, specifically mentioning concerns about the examination of their reproductive system anatomy, and requesting a modified approach that would omit certain standard imaging planes. The technologist is aware that these omitted planes are crucial for a comprehensive assessment of the reproductive organs. What is the most appropriate course of action for the medical radiation technologist in this situation? Option A. Proceed with the modified imaging planes as requested by the patient to alleviate their anxiety and respect their autonomy. Option B. Perform the standard imaging planes but deliberately reduce the image quality in the areas of concern to minimize the patient's perceived discomfort. Option C. Immediately cease the examination and inform the patient that their request cannot be accommodated due to protocol requirements. Option D. Engage in a detailed discussion with the patient to understand their specific anxieties. Explain the clinical importance of the standard imaging planes for assessing reproductive system anatomy, and consult with the referring clinician, if necessary, to explore potential adjustments or alternative strategies. The correct answer is A. Proceed with the modified imaging planes as requested by the patient to alleviate their anxiety and respect their autonomy. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the technologist's professional responsibility to ensure accurate and safe imaging, particularly when those wishes might compromise diagnostic integrity or expose the patient to unnecessary risk. The technologist must navigate patient autonomy with their duty of care, considering the specific anatomical region involved and its implications for reproductive health. Correct approach analysis. The correct approach prioritizes patient well-being and professional integrity by seeking clarification and exploring alternatives. This aligns with the Medical Radiation Technologists Board's MRT Board Code of Conduct, which emphasizes patient-centered care, informed consent, and the technologist's responsibility to perform procedures safely and effectively. By engaging in a dialogue to understand the patient's concerns and explaining the necessity of the imaging protocol, the technologist upholds their professional duty. If the patient's concerns cannot be adequately addressed and the imaging remains clinically indicated, escalating the issue to the referring clinician ensures that the ultimate decision-making authority rests with the medical professional responsible for the patient's care, thereby protecting both the patient and the technologist. This approach respects patient autonomy while ensuring adherence to professional standards and regulatory requirements for diagnostic imaging. Incorrect approaches analysis. One incorrect approach involves immediately acceding to the patient's request without further investigation. This fails to uphold the technologist's professional responsibility to ensure the diagnostic quality of the examination and to protect the patient from potential harm or suboptimal care. It bypasses the established protocols designed for accurate diagnosis and could lead to misdiagnosis or the need for repeat imaging, which is contrary to the principles of efficient and safe radiation use. This approach also neglects the importance of informed consent, as the patient may not fully understand the implications of their request on the diagnostic outcome. Another incorrect approach is to rigidly insist on the protocol without attempting to understand or address the patient's concerns. While adherence to protocol is important, a complete disregard for patient autonomy and expressed anxieties can lead to a breakdown in the therapeutic relationship and potentially result in the patient refusing necessary imaging altogether. This approach can be perceived as dismissive and unprofessional, failing to meet the ethical obligation to treat patients with respect and dignity. It also misses an opportunity to educate the patient and potentially alleviate their concerns, which is a key aspect of patient-centered care. A third incorrect approach is to proceed with the imaging in a manner that compromises its diagnostic value to accommodate the patient's request without proper consultation. This directly violates the MRT board standards for professional practice, which mandate that imaging procedures are performed to the highest diagnostic standard. Compromising image quality for the sake of expediency or to avoid patient discomfort without clinical justification or consultation is a dereliction of duty and can have serious consequences for patient diagnosis and treatment. Professional reasoning. Professionals facing such dilemmas should employ a structured decision-making process. First, actively listen to and acknowledge the patient's concerns. Second, clearly and empathetically explain the clinical necessity of the imaging protocol, including its relevance to the reproductive system anatomy and the diagnostic goals. Third, explore potential modifications or alternative imaging techniques that might address the patient's concerns while still achieving diagnostic objectives, in consultation with the referring clinician if necessary. Fourth, if the patient's request cannot be met without compromising diagnostic integrity or patient safety, clearly communicate this and the rationale. Finally, escalate the situation to the referring clinician for a definitive decision, ensuring all communication and rationale are documented. This process ensures that patient autonomy, professional responsibility, and regulatory compliance are all considered. Question 16. Cost-benefit analysis shows that investing in advanced imaging techniques for complex congenital heart disease can improve diagnostic accuracy, but it also necessitates a deeper understanding of the intricate anatomy of the great vessels and their branching patterns. A patient presents with suspected anomalous pulmonary venous return. Which of the following approaches best demonstrates the MRT's professional responsibility in this scenario? Option A. Utilizing a specialized cardiac MRI protocol designed to delineate the entire course of the pulmonary veins from their entry into the systemic circulation to their connection with the heart, ensuring detailed visualization of any abnormal connections. Option B. Employing a standard echocardiographic protocol to visualize the general cardiac chambers and valves, assuming the anomaly will be incidentally identified. Option C. Performing a high-dose CT scan of the chest to obtain broad anatomical coverage, even if it means exceeding typical radiation limits for pediatric cardiac imaging. Option D. Relying solely on the referring cardiologist's initial assessment without independently verifying the anatomical details relevant to imaging. Correct answer is B. Employing a standard echocardiographic protocol to visualize the general cardiac chambers and valves, assuming the anomaly will be incidentally identified. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical radiation technologist, MRT, to balance the immediate need for diagnostic information with the potential for patient harm due to radiation exposure. The MRT must possess a thorough understanding of cardiovascular anatomy to accurately identify the relevant structures and determine the optimal imaging approach, while also adhering to the principles of radiation protection. The complexity arises from the need to interpret anatomical variations and potential pathologies that might influence imaging protocols, all within the context of patient safety and regulatory compliance. Correct approach analysis. The correct approach prioritizes patient safety and diagnostic efficacy by utilizing the most appropriate imaging modality and technique based on a comprehensive understanding of cardiovascular anatomy. This aligns with the Medical Radiation Technologists Board's MRTB guidelines, which mandate that MRTs practice competently and ethically, ensuring patient well-being and minimizing radiation exposure. By selecting a technique that clearly visualizes the specific cardiac structures in question, the MRT ensures diagnostic accuracy while adhering to ALARA, as low as reasonably achievable principles, thereby fulfilling their professional and regulatory obligations. Incorrect approaches analysis. An approach that involves using a standard, non-tailored protocol without considering the specific anatomical details or suspected pathology is incorrect because it risks suboptimal image quality, leading to misdiagnosis or the need for repeat examinations, thus increasing radiation dose unnecessarily. This fails to meet the MRTB standard of care and the principle of diagnostic optimization. An approach that unnecessarily increases radiation dose to visualize structures that are already adequately depicted by a lower dose technique is incorrect. This directly violates the ALARA principle and the MRTB mandate for radiation protection, potentially exposing the patient to undue risk without a corresponding increase in diagnostic benefit. An approach that relies solely on the referring physician's request without critically evaluating the anatomical implications for imaging is incorrect. While referrals are important, the MRT has a professional responsibility to ensure the chosen imaging technique is anatomically appropriate and safe for the patient, demonstrating independent professional judgment as expected by the MRTB. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough review of the referral and patient history. This is followed by an assessment of the relevant cardiovascular anatomy, considering potential variations or pathologies. The MRT then selects the imaging modality and protocol that best visualizes the target anatomy while adhering to radiation protection principles. This involves a continuous evaluation of image quality and patient response throughout the procedure, ensuring that diagnostic goals are met with the lowest possible radiation dose. This process is guided by the MRTB Code of Conduct and Professional Practice Standards. Question 17. Which approach would be most appropriate for a medical radiation technologist when a patient expresses significant anxiety and claustrophobia prior to an MRI examination? Option A. Proceed with the examination as scheduled, assuming the patient will tolerate the procedure despite their expressed fears. Option B. Immediately contact the referring physician to request sedation for the patient without first attempting to address their anxiety through communication and reassurance. Option C. Engage in open and empathetic communication, explaining the procedure in detail, demonstrating the equipment, and offering reassurance and coping strategies to manage their anxiety. Option D. Inform the patient that their anxiety is not a valid reason to delay the examination and that they must simply endure it. The correct answer is C. Engage in open and empathetic communication, explaining the procedure in detail, demonstrating the equipment, and offering reassurance and coping strategies to manage their anxiety. Explanation. Scenario analysis. This scenario presents a common challenge in medical radiation technology, balancing patient comfort and dignity with the technical requirements of an imaging procedure. The patient's anxiety and potential for claustrophobia necessitate a sensitive and adaptable approach to preparation. Failure to adequately address these concerns can lead to patient distress, non-compliance with the examination, and potentially compromised diagnostic quality. Correct approach analysis. The correct approach prioritizes patient well-being and informed consent, aligning with the Medical Radiation Technologists Board's MRTB Code of Conduct and Ethical Guidelines. This involves open communication, active listening to the patient's concerns, and offering practical solutions to mitigate anxiety. Explaining the procedure in clear, simple terms, demonstrating the equipment, and offering reassurance are crucial steps in building trust and ensuring patient cooperation. The MRTB emphasizes the technologist's responsibility to provide care that respects patient autonomy and dignity, which includes addressing psychological as well as physical needs. This approach fosters a positive patient experience and contributes to the successful completion of the examination. Incorrect approach is analysis. An approach that dismisses the patient's concerns as trivial or overblown fails to uphold the MRTB requirement for compassionate and respectful care. It disregards the patient's subjective experience and can lead to a breakdown in the therapeutic relationship. This approach is ethically unsound as it neglects the duty of care. An approach that proceeds with the examination without attempting to alleviate the patient's anxiety, despite being aware of their distress, demonstrates a lack of empathy and professional responsibility. This can be seen as a failure to provide adequate patient care, potentially violating MRTB standards regarding patient well-being and safety. An approach that relies solely on medication to manage the patient's anxiety, without exploring non-pharmacological interventions first or ensuring proper medical oversight for such interventions may not be the most appropriate or ethical first step. While medication can be a tool, it should be used judiciously and in conjunction with other supportive measures, respecting the patient's right to understand and consent to all aspects of their care. Professional reasoning. Medical radiation technologists should employ a patient-centered decision-making framework. This involves 1. Active listening, fully understanding the patient's concerns and fears. 2. Empathetic communication, acknowledging and validating their feelings. 3. Problem-solving, collaboratively identifying and implementing strategies to address the identified issues. 4. Informed consent, ensuring the patient understands the procedure and any proposed interventions. 5. Professional judgment, applying knowledge and experience to determine the most appropriate course of action within regulatory and ethical boundaries. Question 18. The review process indicates that a radiology department is transitioning from film-based radiography to a new digital radiography (DR) system. A senior technologist expresses concern that the DR system, while faster, may not consistently produce images with the same diagnostic detail and clarity as the established film-based system, particularly for subtle pathologies. They propose a thorough, independent quality assurance (CA) program to benchmark the DR system's performance against film before full implementation. Which of the following actions best reflects the professional responsibilities of a medical radiation technologist in this situation, according to the Medical Radiation Technologists Board framework? Option A. Immediately cease all use of the new DR system and continue exclusively with film-based radiography until further notice. Option B. Implement the DR system for all routine examinations without delay, relying on the manufacturer's assurances of superior performance and speed. Option C. Conduct a comprehensive, independent quality assurance program to evaluate image quality, diagnostic efficacy, and radiation dose optimization of the DR system, comparing it against established film-based benchmarks before widespread adoption. Option D. Delegate the entire evaluation and implementation process of the DR system to the radiology department's IT support team, as they are responsible for new equipment integration. The correct answer is A. Immediately cease all use of the new DR system and continue exclusively with film-based radiography until further notice. Explanation. Scenario analysis. This scenario presents a professional challenge in maintaining diagnostic image quality and patient safety while transitioning to new technology. The Medical Radiation Technologists Board, MRTB, mandates adherence to standards that ensure accurate diagnosis and minimize radiation exposure. The challenge lies in the technologist's responsibility to critically evaluate the efficacy of a new digital radiography system compared to established film-based methods, ensuring no compromise in patient care or diagnostic outcome. This requires a thorough understanding of both imaging modalities and their respective quality control measures. Correct approach analysis. The correct approach involves a systematic evaluation of the digital radiography system's performance against established benchmarks for image quality and radiation dose, informed by MRTB guidelines. This includes verifying the system's ability to produce images with adequate spatial resolution, contrast, and absence of artifacts, comparable to or exceeding film-based radiography. It also necessitates ensuring that radiation doses are optimized for diagnostic efficacy, aligning with ALARA, as low as reasonably achievable, principles as outlined by the MRTB. This proactive and evidence-based approach ensures that the new technology is implemented safely and effectively, upholding professional standards and patient welfare. Incorrect approach is analysis. Implementing the digital radiography system without a comprehensive quality assurance assessment, assuming it is inherently superior to film-based radiography, represents a significant regulatory and ethical failure. This bypasses the MRTB requirement for verification of equipment performance and adherence to diagnostic standards. It risks suboptimal image quality, potentially leading to misdiagnosis, and may not optimize radiation dose, exposing patients unnecessarily. Relying solely on manufacturer specifications without independent verification of image quality and dose parameters is another failure. While manufacturer data is a starting point, the MRTB expects technologists to conduct their own assessments within the clinical environment to confirm these specifications translate to real-world diagnostic performance. This approach neglects the technologist's professional accountability for the quality of diagnostic images produced, continuing to use film-based radiography exclusively due to a lack of understanding or willingness to engage with digital technology, despite its availability and potential benefits, also presents a challenge. While not an immediate safety failure, it could be seen as a failure to keep abreast of technological advancements that could improve patient care and efficiency, potentially falling short of the MRTB expectation for continuous professional development and adoption of best practices. Professional reasoning. Professionals should adopt a structured decision-making process when evaluating new imaging technologies. This involves 1. Understanding the relevant MRTB regulations and guidelines pertaining to diagnostic imaging, equipment performance, and quality assurance. 2. Researching and understanding the fundamental principles and technical specifications of both existing and new imaging modalities. 3. Developing a comprehensive quality assurance plan for the new technology, including specific parameters to be evaluated, e.g., resolution, contrast, noise, dose. 4. Conducting rigorous testing and evaluation of the new system in the clinical setting, comparing its performance against established benchmarks in the previous modality. 5. Documenting all findings and making an informed decision based on evidence, prioritizing patient safety, diagnostic accuracy, and optimization of radiation dose. 6. Engaging in continuous professional development to stay current with technological advancements and regulatory updates. Question 19. The analysis reveals that a radiograph of the left clavicle has been obtained. The entire length of the clavicle is visualized, but there is a noticeable degree of obliquity, resulting in some foreshortening of the midshaft and significant overlap of the distal end with the scapula. The patient reported mild discomfort during the positioning. Considering the requirements for diagnostic quality imaging as outlined by the Medical Radiation Technologists Board, which of the following represents the most appropriate course of action? Option A. Repeat the radiograph, ensuring optimal positioning to minimize foreshortening and overlap, even if it requires repositioning the patient and a slightly increased radiation dose. Option B. Accept the image as diagnostic, as the entire clavicle is present, and the radiologist can likely interpret the image with the existing obliquity and overlap. Option C. Accept the image as diagnostic because the entire clavicle is visualized, and the patient experienced only mild discomfort. Option D. Accept the image as diagnostic, prioritizing patient comfort and avoiding a repeat exposure, despite the foreshortening and overlap. Correct answer is C. Accept the image as diagnostic because the entire clavicle is visualized, and the patient experienced only mild discomfort. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical radiation technologist, MRT, to critically evaluate the diagnostic quality of an image, considering both anatomical accuracy and the potential for misinterpretation due to suboptimal positioning. The challenge lies in balancing the need for a diagnostic image with patient comfort and radiation safety, while adhering to established professional standards and the specific requirements of the Medical Radiation Technologists Board. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the diagnostic efficacy of the radiographic image. This aligns with the Medical Radiation Technologists Board's mandate to ensure that MRTs provide high-quality diagnostic imaging services. Accurate anatomical representation and clear visualization of the relevant structures are paramount for correct diagnosis and subsequent patient management. This approach upholds the ethical obligation to provide competent care and the regulatory requirement to practice within established standards of practice. Incorrect approaches analysis. An approach that accepts an image with significant obliquity and foreshortening of the clavicle, even if the entire bone is visible, fails to meet diagnostic standards. This could lead to misdiagnosis, such as overlooking subtle fractures or degenerative changes, thereby violating the duty of care and the professional standard of producing diagnostic quality images as expected by the Medical Radiation Technologists Board. An approach that prioritizes patient comfort over diagnostic quality by accepting an image with poor positioning that obscures key anatomical landmarks is also professionally unacceptable. While patient well-being is crucial, it must be balanced with the primary purpose of the examination, which is to obtain diagnostic information. This approach could lead to repeat exposures, increasing patient radiation dose, and potentially delaying diagnosis, which contravenes the principles of responsible radiation use and diagnostic accuracy mandated by the board. An approach that relies solely on the presence of the entire anatomical structure without assessing its clarity and diagnostic potential is insufficient. Diagnostic imaging requires not just the visualization of the anatomy, but also its accurate depiction without significant distortion or overlap that could impede interpretation by a radiologist. This oversight could result in mispathology and a failure to meet the expected standard of care. Professional reasoning. Professionals should employ a systematic approach to image evaluation. This involves first confirming patient identification and the requested examination. Then, assess the image for technical factors such as exposure, contrast, and absence of artifacts. Crucially, evaluate the radiographic positioning against established protocols and anatomical landmarks, ensuring all relevant structures are visualized without undue distortion or overlap. Consider the clinical indication for the examination and whether the image provides sufficient information for diagnosis. If the image is suboptimal, the professional must determine if a repeat exposure is necessary, weighing the diagnostic benefit against the radiation dose and patient factors. This decision-making process is guided by the Medical Radiation Technologists Board Standards of Practice and Ethical Codes. Question 20. Process analysis reveals a patient undergoing a contrast-enhanced CT scan of the abdomen begins to feel lightheaded, nauseous, and their skin becomes clammy and pale. They report feeling like they might faint. The technologist observes the patient's pulse becoming weak and thready. Considering the immediate physiological responses that can occur during contrast administration and imaging, what is the most appropriate initial action for the technologist to take to manage this situation? Option A. Continue with the scan, instructing the patient to try and remain still. Option B. Administer a prescribed antiemetic medication from the emergency cart. Option C. Ask the patient to sit up and take deep breaths to calm down. Option D. Immediately position the patient supine with their legs elevated. The correct answer is D. Immediately position the patient supine with their legs elevated. Explanation. Scenario analysis. This scenario presents a common challenge in medical radiation technology where a patient's physiological response to an imaging procedure requires immediate and informed intervention. The technologist must balance the need for diagnostic imaging with the patient's immediate well-being, demonstrating a critical understanding of anatomy and physiology in a practical, high-pressure situation. The challenge lies in accurately assessing the patient's condition, understanding the underlying physiological mechanisms, and acting decisively within their scope of practice and established protocols. Correct approach analysis. The correct approach involves recognizing the signs of a vasovagal syncope episode, which is a physiological response related to the autonomic nervous system. Understanding that the vagus nerve can cause a sudden drop in heart rate and blood pressure, leading to fainting, is crucial. The technologist's immediate action to position the patient supine with elevated legs is based on the physiological principle of improving venous return to the brain, thereby mitigating the effects of hypotension. This action directly addresses the immediate cause of the syncope and is within the scope of practice for a technologist to ensure patient safety during an examination. This aligns with the Medical Radiation Technologists Board's emphasis on patient care, safety, and the application of anatomical and physiological knowledge to manage adverse events. Incorrect approach is analysis. One incorrect approach would be to dismiss the patient's symptoms as minor or unrelated to the procedure, continuing with the examination without assessment. This demonstrates a failure to apply fundamental anatomical and physiological knowledge regarding the body's response to stress or stimuli. Ethically and regulatorily, this constitutes a breach of duty of care, as the technologist has failed to identify and respond to a potentially serious adverse event, putting the patient at risk of injury from a fall or prolonged symptoms. Another incorrect approach would be to administer medication without explicit medical direction or a pre-approved protocol. The technologist may recognize a physiological issue. Intervening with pharmacological agents without proper authorization or training exceeds their scope of practice. This could lead to adverse drug interactions or inappropriate treatment, violating professional standards and potentially contravening regulations regarding the administration of medicines. A further incorrect approach would be to simply ask the patient to stand up and walk it off. This ignores the physiological basis of vasovagal syncope, where the sudden drop in blood pressure and heart rate requires a specific management strategy to restore adequate cerebral perfusion. Forcing the patient to stand could exacerbate the symptoms, lead to a fall, and delay appropriate care, representing a failure in professional judgment and patient management. Professional reasoning. Professionals should employ a systematic approach. 1. Observe and assess. Continuously monitor the patient for any changes in their condition. 2. Recognize symptoms. Identify signs and symptoms that indicate a potential physiological issue, drawing upon anatomical and physiological knowledge. 3. Understand underlying mechanisms. Recall the physiological processes that could be causing the observed symptoms. 4. Act within scope of practice. Implement immediate interventions that are safe, appropriate, and within the technologists' defined professional responsibilities and institutional protocols. 5. Escalate when necessary. If the situation is beyond the technologist's scope or expertise, or if the patient's condition deteriorates, promptly seek assistance from a qualified medical practitioner. 6. Document thoroughly. Record all observations, interventions, and patient responses accurately.